González Gómez. She lives in Argentina. For 5 years she has her own school there, her homeopathic school, and only vets are allowed to attend the school. She has students from Argentina, Colombia, Ecuador and Brazil. And she has the school together with her husband. Is he a vet also? He's a vet. Okay. She's doing mainly small animals, and she will tell us something about case taking and remedies and so on.
Okay.
Well,
Thank you very much.
thank you. Here you go.
Okay.
Thank you, Elizabeth, and thank you for the invitation. Good morning, everybody. Good morning. Okay, maybe it's better here. Okay, today I would like to talk to you about acute case. A very simple, quickly and certainly approach from Prafull Vijayakar. I don't know if somebody knows about predictive homeopathy. Who knows?
From you.
Very nice. Congratulations. So everything that I will talk is from him. He is a greatest physician from Bombay. He has a special clinic for poor people. He is a tourism doctor. This is the clinic called Hope for the Hopeless. It's a free camp. You can see that kind of people with severe diseases. Many patients every day comes to him clinic with terrible diseases, severe. It's a nice job. Look at him. This patient, maybe with paralysis. And he used to work with many doctors. He has a special team with many doctors, and he used to teach about predictive homeopathy in his school. So he prepared all the team, especially for predictive homeopathy. This is very important because they have all the same view in each case. Well, let's talk about the classification of the diseases. Maybe mostly you know, but some new people will need it. Okay, case taking. When we have to take the case, we have at first to think, are we in front of a chronic case or an acute case? Because it will be very, very different. At first, I have to explain 3 kinds of chronic diseases: psoriatic diseases, psychotic diseases, and syphilitic diseases. Those are called by Hahnemann. But I will explain another disease is like acute psoriatic disease, like infection diseases. In human being, this chart is made up by Prafull Vijayakar, and he is a physician. So we have viral fevers, in this case, influenza, tonsillitis, pneumonia, typhoid, pneumonitis, septicemia, etc., etc., etc. But we have to know something. The chart that I will explain in this day is only for this acute psoriatic disease. It's very, very important. You will see why. Later I will tell you. It's very important. So, in these cases, use Dr. Vijayakar's chart of acutes only for these. But we are vets. So, what kind of diseases are we going to take with this chart that I will explain later? Okay, in veterinary medicine we have in canine parvovirus, distemper, hepatitis, leptospirosis, infections like kennel cough, digestive indisposition like food poisonings, etc., etc., etc. Those are very, very important for us in canine. Well, and in feline we have this one, respiratory disease complex. It's in red because at the end of the lecture I will explain one case, a very interesting case. But this case is a defective case. Who knows what is a defective case?
Yeah.
David,
Yeah, I know.
tell us.
They are shy, they know. Defective cases are cases with general, non-homeopathic symptoms. There are mainly pathopneumonic symptoms.
Common symptoms. Okay. So in this case, it's very difficult for us, especially if we are a vet, because the people talk. And if we have a dog or cat who talks, it's terrible. Okay, another kind of diseases, feline viral leukemia, feline immunodeficiency virus, digestive indispositions like the other one, etc., etc. So those are acute diseases that will be used for this kind of chart. Before, I have to explain something about how to take the case or some basic information about acute cases or cases. ITIS. Everything where we are talking about ITIS is for this kind of chart that we can use. Will be very useful for you. Okay, another question. Is homeopathy for emergencies? What do you think?
Of course.
Sure.
Yes? Yes. But we use every day and it's very easy to find the remedy.
Yes.
Be honest, please. It's
Yes.
very easy.
Sometimes.
It is difficult because sometimes you call your physician, your homeopath, and he said, "Oh no, maybe call your allopathic doctor because take an antibiotic or take a corticoid, something like this." No, because it's difficult to find sometimes, especially if they call you, with some symptoms. Well, so the limitations maybe is for us, physicians or vets, not for the homeopathy. The homeopathy has a lot of remedies, 3,000, 4,000. So there's no limitation for homeopathy. It's our limitation. That's the issue. Okay. Another special and strange concept. Some doctors give homeopathic remedies with a allopathic concept. Do you know what I mean?
Yes.
Like what? Okay, aconitum for fever, nux vomica for intoxication, ipecacuana for vomiting, podophyllum for diarrhea. We have to know that those are an old and wrong concepts. We are a homeopath and we always have to treat the patient, not the disease. It's very important to understand that. Okay, let's talk about not homeopathic principles. Prescribe for the disease symptoms. Those are common. They already tell us. Prescribe more than one remedy. Hyman talks about this. Only one remedy for one disease. Why? Somebody want to explain why we have to give just one remedy? Who wants to tell us?
Here.
It's nice because we have students here. Not everybody is a homeopath. You take it.
No, which is the first one?
Oh, the first.
Here.
Don't do more.
Give him
don't
the
use your cell phone.
mic.
We are here. Okay. Well, this is prescribed more than one remedy. What's the other? Prescribed mixtures of remedies will be the next one. Which one? Okay. Prescribe just one remedy. Why? What is the reason? Just one remedy for the patient.
Because pathogenetics of the remedy is show us the totality. If you use 2 remedies, for example, you don't know which is working, you know, and also that there are no pathogenetic status on using 2 remedies together. We have only pathogenetics data on a single remedy.
Perfect. 10.
Keep the mic.
10 from 100.
Okay. These are blind prescriptions. If you do one of these, are blind prescriptions. Okay? Next one. Bad evolution parameters. Suppose you give a remedy, and after you give a remedy, if it has a fever or something like that, the fever is very slow drop in temperature, like this, very slow, very slow. It's a bad symptom. After the remedy, lost appetite, it's a bad symptom. Or body ache, or fatigue, or is tired. Everything is very, very bad. If you have 1 or 2 of these symptoms in your patient, they do not represent a homeopathic result. We have to understand this. Now the opposite. A good evolution. Recover vitality is the first thing that you will see. It's incredible. Oh, I get a remedy and it's different. Now it's with more activity. Recover the appetite very quickly. Desire to return to their usual activity. And what happened with fevers or pain? Well, quickly disappear between 24 to 84 hours, no more than that. It will be very, very quickly if you give the perfect remedy. Okay. This concept is very important and it's from Prafull Vijayakar. I never heard this before. Prafull always said, Heron's law must always be observed. In any case, in any acute case, you have to observe this law. Okay, another concept very interesting from Prafull Vijayakar. Dr. Peter, where is Dr. Peter? He talks 50 minutes about similable or constitutional this morning, no? Well, for Prafull Vijayakar, he said the same, but a little different, is the constitutional similable genetic. Our remedy is similable, constitutional, or this one is the same. And he explained that we have like a family of remedies. I have my remedy, but when I get sick, like in acute case, I have different kind of remedies, like a satellite remedies that can be used for me. Very nice. So we have a mathematical relationship between the constitutional similable and my acute remedies. Very, very interesting. So we have this doctor, Robert Gibson Miller, who give us a list. In this book, I don't know if somebody have it. Well, look at the list. maybe is another one also, but I want to show you this part of the book. And it's very interesting because you can see the remedies. Suppose your patient is lachesis. And you know, oh, always is lachesis, this patient. But in this moment has kennel cough, acute disease. No? So you can take this list and try to see what kind of remedies are in his family. It's like a family remedies. And maybe the patient is one of these remedies. But first we have to see if it's a hot remedy or chilly remedy. It's very important. Okay, another very, very important point. Erroneous form of prescription. Some doctors used to give the remedies only for mental symptoms. Like we are only mental. Very strange, no?
We are, kind of.
Or another doctors give the remedies only for strange and peculiar symptoms. Just for a little part of us. Or just for the clinical picture. Or only use what kind of organ is affected. So if it's affected the liver, maybe give some remedy especially for liver. If it's for a lung, especially for lung, something like that. Well, none represents the whole this. We have to remember, we are a homeopath, we only try to be holistic, so never do this. Never. In the next one you will see the chart. And it's different. You have different kind of spheres of the body. Look at this. Before to explain the chart, I have to explain the 5 elements. You know, acupuncture told something about this. It's quite different, but in La India, they have 5 elements also. But the name in Sanskrit is Pancha Tattva. Here you can see, this is the energy, this is the air, this is the fire, water and earth. So this concept is very, very interesting because in the life we have developed from those elements. And those elements are in our body also, represents some part of our body. This is a very, very interesting concept. Let's see. The energy represents our activity. Very famous, no? Air in our mind. Where are your thoughts? Where is it? You can catch it. It's like air. It's in your mind. It's like this. No? Fire are thermals. Water, thirsty. Is the relationship between water and me. Is through thirsty. And earth, body. You can touch it. It's very comfortable. Is the earth. Is our earth, our body. Okay. And now I present you the marvelous chart made up by Prafull Vijayakar. I will explain very easily with colors. This one is in Portuguese because when the Dr. Prafull Vijayakar 11 years ago went to Brazil and we start to learn predictive homeopathy with him, the people from Brazil traduced, so it's Portuguese. Translated. Okay. The yellow part is activity. But the activity divides in decrease, normal, and increased. Then, the red one is the relationship with the thermals, no? The thermal may be, or can be, chilly or hot. Okay? And the third element is the relationship with the water. The water is in green and can be without, like thirstless or thirsty. It's very easy. You will have at the end a gift for yourself. And you will have a book, the Prafull's book, Acute Case book, and a special app that I will give you. Everyone can get it, okay? At the finish, I will give you. So don't worry. This is the chart.
Can you just explain what is there, because it's a bit difficult to read?
Okay.
Or this what?
In this part is
In the last.
In the last is in Portuguese. This is in English. Activity divide into decrease, increase, and no change. The other one is, if it's very sleepy, the patient is like this, sleep overpowering, or is dullness like this. Always dullness. That is different than sleeping. Mm-hmm. Or can be increased, that I will explain later, okay? Or normal. But it's very easy, you will have it. Okay. You will have everything in your cell phone, better than this, okay? Why we have to talk about energy? Because energy is our activity. What happened when we was born? The first, we start to cry. Our first activity was, it's alive. Or not. Okay. So, action is the primary reflection of life. And we know that we can give remedies opposite about the action. Suppose, if the animal goes to your clinic like this, you will give belladonna, analgesics, a fast remedy. No, you have to give some remedy like calcarea, varita carbonica, gelsemia or gelsemia, belladonna, silicia, some slow remedy.
The bottles.
Belladonna can be the same.
I know.
Perdón, elevorus, I excuse elevorus. The same is other one. Okay, entonces this is slow. Slow is different. Very opposite that fast. We don't have that kind of mistake. Because sometimes you take a case and you give remedy for revitalization. But it's the opposite. So, in this chart, we can see the activity very specific. Look, if it's increased, our patient, you have a physical restlessness or mental restlessness like anxiety or verbal activity. Maybe it's all the time barks, moans, howls, a lot loquacity, no? If it's a person who's talking like this. Or can be decreased. In decrease we have rest or sleep. That especially is dullness or sleep. Or no change. No change is suppose like Brazil. Don't worry, be happy. Tudo bem, brasileiros, no? Brasileiro here, who is? You say, you are like opium. You are like opium, satisfied, tudo bem. A lot of problems with the president, no? But you say, oh, tudo bem. You are always satisfied. Opium is like that. Or aversion to consolation like Natrium muriaticum. Or does not want to be bothered like Silesian. So it's very interesting. Second one, the relationship with fire element is the thermal modality. Okay, let's go again with Dr. Gibson Millers. He talks about chili remedies, and he has the list, look at the list, and hot remedies. He says predominantly chili and predominantly hot. Very, very important this. But we have to explain something about this. If you use your computer, your regularization, or if you use CAD or that, whatever, you will find aggravation and amelioration that is different than this.
Yes.
It's totally different. This is a special list that I will explain a little bit in the next one. Well, Dr. Margaret Tyler thinks the same. It's an eliminatory rubric. If your patient is a hot patient, you can't give a chili remedy. It's a terrible mistake, but many physicians and vets does. So, remedy classification is chili remedies, hot remedies, and we have a little ones like ambithermic remedies that they are mainly affected by heat and cold extremes. Like what? Like Antimonium crudum, Cinnabaris, Ipecacuana, Mercurius, Natrium carbonicum. But what is the issue? The issue is tolerance. We have to talk always about the tolerance. That list that I already showed you about Gibson Miller is the tolerance about cold and heat. Do you tolerate that? How is your tolerance? Not aggravate or ameliorate. No. It's different. So you have this list with you all time, and you can check what happened with your prescription. You don't have it in the repertory radar or another repertories. You don't have it. The last element is the water. That's we only have to ask: is thirst or is thirstless? No more than that. Just to find this. It's very easy. Okay. So for this chart, we have an axis. The axis is very, very simple to find. You have to ask about activity, thermal sensitivity, and thirst. This is for your acute chart that I already showed you. But maybe you have a behavioral symptoms, characteristic, or desires and aversions, or physical symptoms, very interesting. You can take it, and you can also do a repertorization. You can do it, and you can do both. You can check what happened, this one with your chart, and with this. But what happened in animals, in vet, for us, sometimes we don't have this. What we can do if we don't have any symptom? The cat is like this, that I will show you. No more. Well, Prafull help us. She offers the chart for us. Okay, let's remember some golden rules. The first one is single medication. David explained why. Search for axes, activity, temperature, and thirst. Observe the moon phases. Why do you think we have to observe the moon phases? Who wants to talk? What happened with the moon? Nobody knows?
With the mic.
Huh?
Perhaps activity changes.
You know, many people with the full moon and with the new moon have like an acute case. And Prafull, sometimes people call him and he thinks, oh, the full is moon. And maybe he gives a placebo for 3 days. And everything disappeared because it was for the moon. Just for the moon. A new moon or full moon aggravates many people. Who aggravates with full moon here? She was continuously stuck to the stomach. All the time. Total absence of thirst. Marvelous. So in this point, you just have the 3 elements. The 3 points, your axis. It's very easy to use this. And you will have it in your cell phone, everybody. Very nice. Okay, anorexia, not eating for 5 days. Terrible. A feline. Local symptoms are those common to the feline respiratory disease complex. So, for me, common symptoms I never take. I don't take it. It's from the disease, not from my patient. I would like to have characteristic symptoms, not common. We are a homeopath. So, with this, give me, please, the remedy. Tell me, what remedy would you like to give? I want to hear you.
We want more symptoms.
No, there's no more. It's a defective.
Okay.
Who wants to give a remedy for this patient? Tell me, please.
We need your table.
What?
We need your table.
You need a table. No. you never heard about practical homeopathy. You are a classic homeopath. What do? You have to give a nice remedy for this case. Big problem.
Calcinium.
Okay.
Yes.
Big
Calcinium.
problem.
Calcinium.
Calcinium. Interesting. No. You will see. No. Okay. Remember again. This acute chart that I will show you again is only for these acute psoriatic cases. Never uses in exacerbation of the chronic miasm. Why is the reason? Tell me what?
Because then you should use
Yes.
the constitutional remedy.
What happens if I use this chart for chronic case?
I suppress.
What do you, what?
Suppression.
Suppress. 10 points here. Good. You can have a terrible suppression. Please, don't use it. Never. You have to know what is your case. If it's real acute case or chronic case. Otherwise, it will be terrible if you use it opposite. It's the only thing I beg you. Okay. So again with the chart, where we are with Jassy. Where is Jassy? Her activity is increased, normal, or decreased? Is decreased or increased?
Decreased.
Is decreased. Very simple. How is her? She is dullness,
Yes.
like dullness, or she? Like
Sleepiness.
dullness, or she is sleepy?
Sleepy.
Sleepy. So where is her? Is somnolencia in Brasileira. So it's sleepy here. Sleepy. This is dullness, like levels. No? Okay. And this is chilly or hot?
Chilly.
Very simple. So we are here. How many remedies do we have? Antimonium tartaricum, Eleverus, Nux moscata, and Sabadella. Now we have remedies. Thanks to Prafull Vijayakar, who takes a lot of cases every day, hundreds and hundreds of patients every day in his clinic. he could made up this kind of chart. It's very interesting.
Carolina, maybe you could explain why she's sleepy and not dull?
Okay.
Her behavior?
Yes, because in the differential diagnosis, I will explain. In Eleverus. Eleverus is a remedy, if it's a constitutional remedy, it's a person who is too dullness all time. It's like this, too dullness. What time is it? Today is Wednesday, no, it's Sunday. Like this, it's very dullness.
And slow.
Levels, but all the time. In this case, the patient was not the case. Like this great dullness, like a state of stupor, which is maintained upon awakening. Slowness and in movement, indifference to everything. So this is her levels. But when Jessie woke up, her movements were not slow, and she was connected to the environment. This is the difference. She was like this, sleepy, but she sometimes wake up normally. Again, sleepy, it's different than a level. A level all time is dullness. It's okay? Okay. Well, the second remedy is antimonial tartaricus. It has the same axis, sleepy, chilly, and thirstless. So, excessive weakness in people is perspiration. In horses, for Petra, will be nice this. Excessive perspiration, excessive sleep, this is antimonial tartaricus. But it's not the case, and the main tropism is bronchopulmonary. It's lower. And we know that it's an upper disease, our problem, no? The complex disease is upper. So it's not the remedy for my case. Nux moscata, what happened with Nux moscata? The same axis. But dry mouth with no thirst. Dry mouth, so dry that it sticks to the palate. That's not the case. Dry stools, etc., etc., etc. No, it's not the case. And finally, we have Sabadella, our marvelous remedy. We never think in Sabadella if Prafull doesn't exist. Sabadella. Axis sleepy, chilly, thirstless. We have a paroxysms of spasmodic sneezing with lacrimation, secretion, and nasal obstruction. It's like our feline complex is like this. Main tropism is, it has marked tropisms to upper respiratory system. Exactly, it fits perfectly for my patient. So this is the best remedy for this case, thanks to Prafull Vijayakar. So I gave 1 monodose of Sabadella 30 centesimal. 7 globulus monodose. What happened? Follow up. The next day, Jessie was more excited, but with more nasal congestion. It's normal. A little aggravated is good. No problem. She sneezed a lot. Nasal secretion increased. Next day, Jessie began to eat. Very nice. Remember, 5 days without eat. And it was very quickly. She had less nasal congestion. It was fulfilled recovery. Marvelous case. So, the conclusion is, patient defective in appearance, because in this case it's in appearance because we can use the chart. Without the chart is a real defective case. Objective and clear symptoms can be compared with the acute chart in order to find the remedy most similar to the acute case. This is the conclusion, and you can observe this in most of the cases, and it will be very, very helpful for everybody. Okay, in this moment, I would like to show you, take your cell phone,